Hemophilia.
No, never heard of it before.
Hemophilia. I don't know about that. Is it some kind of thing like malaria?
Yeah. No, I don't know. Where's that?
Never heard of it.
This is John. When John falls and gets injured, his body gathers blood cells to form a clot that halts his bleeding. Blood proteins called clotting factors work with platelet-like cells to produce this clot. On the other hand, we have Sarah. When Sarah falls and gets injured, similarly like John, she bleeds excessively due to insufficient clotting factor. This is because Sarah has hemophilia. Hemophilia is an inherited bleeding disorder in which the blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries or surgery. The symptoms of hemophilia include profuse bleeding from cuts or bruises, especially following a surgery or dental work, significant or severe bruising, uncommon bleeding with immunizations, joint discomfort or stiffness, blood in feces or urine, nosebleeds, and inexplicable irritation in children. Hemophilia can result in bleeding within the joints that can lead to chronic joint disease and pain, bleeding in the head and sometimes in the brain, which can cause long-term problems such as seizures and paralysis. Death can also occur if the bleeding cannot be stopped or if it occurs in a vital organ such as the brain.
Since hemophilia is a genetic condition someone is born with, there is currently no way to prevent the disease. But here are some prevention steps hemophilia patients like Sarah can take to avoid excessive bleeding and protect themselves. Exercise regularly, practice good dental hygiene, get vaccinations, and protect themselves from injuries that could cause bleeding.
Hemophilia is actually a hereditary disease whereby compared to a normal person, the tendency to bleed is take longer for it to stop. So, however, I think that hemophilia is not a hindrance to us, especially to the patient itself. So, some of the measures that we should take is have to maintain our body weight, because if you are obese, then you actually need to consume more in terms of the medication. So, one is you have to make sure that you control on your diet, and also do sports. All the sports that preferably is non-contact sports, swimming especially is good for hemophilia. And also for the patient itself, when you are being advised from the doctor on your treatment, make sure that you do not miss your treatment and follow all the treatment, because compliance is key to make sure that the tendency to bleed is lesser. So hopefully with all this, there is less tendency for the patient to have a bleed and all the joints is protected and we can live a fulfilling life.